Hi, everybody. Thank you, John. Geez, that was so nice. That was way more than I deserve. It kind of reminds me, since we're in Minnesota, I used to be a political reporter, and I covered a great Minnesotan, Walter F. Mondale, who was a senator and the vice president of the United States, and he was a pretty funny guy. And one time he was running for president. He didn't win, but he did run for president. And I was somewhere, and the local Democratic chairman stood up to introduce their candidate for president. And they said, man, this guy, Walter Mondale, one of the all-time giants of the United States Senate, an absolutely fabulous person in every way, like John just said about me. And Mondale stood up and said, thanks, Bob, for that introduction. It's just about the way I wrote it. That's kind of how I feel. It's very pleasant for me to be here. I'm delighted to be here. I think anybody who's interested in health policy likes coming to Rochester, Minnesota, a whole town built around the concept of high-quality health care. It's kind of amazing to me. And I don't know, probably all of you know this. Most Americans don't know. I mean, the Mayo Clinic, I'm sure, is the most famous medical center in the world. It's also a low-cost medical center. If you compare to other counties around the United States, Rochester, Minnesota has healthcare costs way below the national average, despite having the most famous hospital in America. So it's kind of exciting to me to come here to a place that has high-quality healthcare at way below average costs. In fact, for me, the Mayo Clinic is kind of a problem, and the reason is, as you're going to hear in a minute, I've been going around America arguing that our healthcare system is just not good enough for the world's richest country. We pay way too much and get way too little in return. And when I say that, here's what I get quite often from Americans. Oh yeah, well, if we're so bad, how come Arab sheiks and Brazilian soccer stars fly to Rochester, Minnesota when they get sick? Because they do. They all come to the Mayo Clinic. And of course, the answer to that is, if every American could go to the Mayo Clinic and pay out of pocket, we wouldn't have a healthcare problem. This is a model that could work. And of course, it would be rude for me to challenge my hosts here at the Mayo Clinic. But may I just suggest, here you've hit upon a very high-quality model at reasonable cost, and you're only operating in 3 of our states. Why don't we have a Mayo's in Colorado or Kentucky or Carolina? I just throw that out as a general challenge. But my job tonight is to take us out of Rochester, Minnesota, to take us out of Minnesota, to take us out of the United States, and kind of look around the world for possibilities, just to get us thinking about what we might do, what we could do in the United States. And frankly, it's a little daunting for me to speak about this at the Mayo Clinic of all places, because I'm not a doctor, I'm not a healthcare economist, I'm just a reporter, an ink-stained reporter, as John said, who got interested in this topic. And I think what got me interested was I came to realize this paradox. The fact is, at the beginning of the 21st century, the United States of America is the richest, strongest, freest, most innovative country on earth, probably the richest, strongest, most innovative country in world history. And yet in this area, very important area of human endeavor, keeping people healthy, we're a third-rate power. We just don't stack up against the other wealthy countries in the world. We pay more, as I said, and we get less than all the other wealthy countries. Here's the thing. This is what I discovered when I began looking into this as a reporter. All the other countries like us, and I mean by that advanced, high-tech, free market, capitalist democracies, there are about 30 of them in the world, depending on how broadly you want to define democracy. All of those countries provide health care for everybody, all their citizens, all their aliens, legal or illegal, for everybody, of high quality. In fact, according to the Commonwealth Fund in New York, most of the other rich countries have better healthcare outcomes than the United States. I don't mean people who come to the Mayo Clinic, but I mean overall. We rank pretty poorly in the Commonwealth Fund's international comparisons on most areas. We're the best in some areas. We're number one at recovery rates after a diagnosis of breast cancer. We're really good at that. We're very good at recovery rates after a diagnosis of prostate cancer. But many other areas, chronic diseases, et cetera, the United States ranks near the bottom of the rich countries. The Commonwealth Fund has this measure, I think the term is avoidable mortality amenable to treatment, which I think is a fancy way to say curing a disease that could be cured by modern medicine. Guess what? On avoiding mortality through treatment, the United States ranks 19th out of the 23 richest countries. And many other areas, our quality is just not up there, and yet we pay more than all the other countries. The problem here is not the people who can go to the Mayo Clinic. It's not people who can go to the fine hospitals and brilliant doctors in American cities. The problem is all the people we don't cover. According to the Census Bureau, in June of this year, 48.6 million Americans did not have health insurance. And that can be a lethal condition in our country. According to the National Academy of Sciences, about 25,000 of our fellow citizens die every year of treatable diseases because they couldn't afford to see a doctor. And people say, no, that's impossible. We would never let that happen. Yeah, we let it happen 25,000 times a year. John mentioned that this is the week of 9/11. On 9/11 of 2001, we lost 3,000 Americans. And we've spent hundreds of billions of dollars since then to make sure it doesn't happen again. That same year, we lost about 20,000 to 25,000 Americans to treatable disease, and it's happened every year since because we haven't gotten to the point of providing health care for every American. And guess what? It doesn't have to be that way. That's my message to you. You know how many Brits die every year of treatable diseases because they can't afford a doctor? 0. France, 0. Germany, 0. Austria, 0. Switzerland, 0. Japan, 0. Other rich countries don't let this happen, and my argument to you is we don't have to let it happen either. So just as a reporter, I got interested in this paradox. How come the other rich countries are doing better? How come they can manage to provide health care to everybody of high quality and still spend, on average, about half as much as we do? How do you do that? And just as a reporter, I went around the world trying to figure out how they do it. And tonight they didn't give me much time. I mean, really, we got to go around the world here. They gave me half an hour, but I'm gonna talk really fast and talk about how they do it. And while I was going around the world trying to figure out how these countries manage to cover everybody, I realized that there was another question that's just as important, and that is why? Why would a country make the commitment to provide health care for all its residents? If you think about that one for about 2 minutes, it leads to one more question. Why doesn't the world's richest country provide health care for all its residents? Why would the world's richest country want to let 48 million people leave them outside the door until they're sick enough to go to the emergency room? So those are the questions we're going to try to deal with here. And did I mention this? They really didn't give me much time, so I got to go very fast. And I'll try to be fair. I'm going to be an objective reporter here. I'll tell you what works in these other countries and what doesn't work. And since I'm going to be a fair, objective reporter, I'll come right out here and tell you my hidden agenda. I'll tell you the real reason I came to Rochester, Minnesota today. They didn't give me much time. Did I mention that? So I really have to go through this quickly. Just give you the briefest overview. And what I'm hoping is that some people here will hear this quick review and say, gee, stuff was pretty interesting. I wonder if there's a book I could buy about that. That's the plan. Now, I first got interested in this topic in Japan. My family of Americans was living in Japan, and this is a country with a fabulous healthcare system. As you may know, the Japanese are the healthiest country in the world. They have the longest life expectancy. They have the best recovery rates from almost every chronic disease. the major disease, they have the latest onset of what we would consider to be standard diseases of aging. It's a really healthy society. They provide health care for everybody. They're the most prodigious consumers of health care in the world. The Japanese go to the doctor on average 16 times a year. We go 3.9 times a year. And get this, we're spending at the moment about $7,900 per year per capita on health care. The Japanese cover everybody with great results and spend $3,400 a year. Great results, half our cost, very good outcomes. And I discovered this because we were living in Japan, and every once in a while one of my kids would get measles or somebody would break a wrist or something, and I went to the doctor in Japan for some ailment. I can't even remember what it was. And it's kind of like going to, it's a rich country. It's kind of like going to an American doctor. I don't know what it's like for you, but I live in Colorado, and you go into the doctor's office and you kind of wait around the waiting room. You read National Geographic or something, and eventually a receptionist comes out, usually in a white outfit, and in America they can't say your last name anymore, so she says, "Tom, is there a Tom here? A Tom anywhere?" Yeah, I say, "Yeah, that's me. Come on in," like that, right? So here's what happens in Japan. You walk in, it looks just like an American hospital. They have the Japanese National Geographic. You're waiting in the waiting room, and the receptionist comes out, and here's what she says. She says, "Tomaso Rido-sama irashaimasuka ka?" Tomaso Rido-sama irashaimasuka ka? And that means, has the highly honorable Thomas Reid graced us with his presence today? You feel better before you see the doctor. It was... So, and of course, the other interesting thing about going to the doctor in Japan, as my wife and I noticed, was the cost of treatment was minute. It's minute. It was 1/5 as much, 1/10 as much, 1/20th as much as we would pay in America for the same treatment. I mean, if one of my kids got an earache or something, we went to the doctor. Quite often, I didn't even bother mailing the bill home to my insurance company because the postage was more than the doctor bill. So, this is when we started thinking about this. How do other countries do this? And so I went around the world to try to figure out how other countries manage to cover everybody. And as John has been saying tonight, every country's healthcare system reflects its history and its culture. There's a great deal of cultural overlay on any healthcare system. And so every system is unique. And yet you can group them. I'm not going to have to go through 200 countries tonight. I don't even have to go through all of the 36 countries that the World Health Organization rated as better than the United States, because they fall into certain categories. And I've put all the healthcare systems of the world into 4 models. And with variations, all the countries fall into one of these models. And I'm just going to have to go through them very quickly without too much detail. And I tell you what, we'll start our tour, right here in Great Britain with the Beverage Model. This is named for Lord William Beveridge, who was a famous social reformer in Britain. And he's the guy who invented the National Health Service in Britain. And it's based on the proposition that nobody should ever pay a doctor bill. Because in the British National Health Service, in the Beverage Model, caring for your health is government's job, just like running the parks and picking up the trash and paving the streets, like the public library. It's a service you get when you need it, and you don't pay a bill. Of course, they pay. They pay very high taxes to pay for this system. But this is a government-run system. In the Beverage Model in Britain, government owns the hospitals. The doctors, the nurses, the lab technicians, et cetera, who work in the hospitals are all government employees. This is not true in every beverage country, but in Britain, the general practitioners are private. They have an office, what we would call a doctor's office. They call it a surgery just down the street. You go to your general practitioner, your primary care doc, or she comes to you. In our case, she came to our house, but you don't pay. The National Health Service pays her. So this is a system where government provides the care, for the most part, government pays for the care. It's a government-run system, and these systems work pretty well. Britain covers everybody, including all their illegal aliens. They have slightly better health outcomes than the United States, and they spend 44% as much per capita as we do on healthcare. Everybody's covered, the care is fine, costs less than half. And because this system tends to work, it's been copied in a lot of countries. The Beverage Model is used in Spain, Italy, Austria, New Zealand, all the Scandinavian countries. Cuba is a classic case of government-run healthcare using the Beverage Model. It works pretty well. Let me just ask this question. You don't have to answer right away. I just want you to think about it. Would you say that this is socialized medicine? If government pays for the care and government provides the care? Please ponder that. But I don't want you to think that the way to get everybody covered, the route to universal coverage, is some big government nanny-state system, because it's not necessary. And to prove it, we're now going to jump over to the mainland of Europe and see if I can make this work. We'll see the Beverage Model. Can we get to the next one? There it is, the Bismarck Model of healthcare. The Bismarck Model is named for this warm and fuzzy individual, Otto von Bismarck, who was a Prussian general, and he's the George Washington of Germany. In 1871, he combined about 20 German-speaking fiefdoms and principalities in the heart of Europe into a new nation, Deutschland. It means the land of the German speakers, or Germany. And he was a great social innovator. He was, you can see, he's a general. He's always pictured with a spiked Prussian helmet. And he's what we would call a Republican. He was a low-tax, small government, big business is best kind of guy. That's what he believed in. But he was also very strongly influenced by his Lutheran religious background. And among many innovations in the ideal of government, Bismarck decided in 1883 that a rich, modern country should provide health care for everybody. This was a completely bizarre notion at the time. No government had ever taken on this responsibility. And he needed this because he needed to man the biggest army in Europe. He was the biggest manufacturing country in the world. He needed to have healthy people for his factories. But Bismarck also said, when he was challenged by his fellow conservatives, what do you mean, you're going to welfare state? You're going to give everybody health care? Bismarck said, I think we should look on this as applied Christianity. He said, we've been taught to care for the least of our brethren, and if we don't care for them when they're sick, we're not living up to our cultural obligation, our moral obligation. And so he set up a system, but I told you he's a Republican. So he set up a totally private system. In the German, the Bismarck model, the docs are private, the hospitals are private. They have a few university hospitals, but almost all the hospitals are private. And the insurance, the payment scheme is private. In Germany, everybody has to buy health insurance. You buy it from a private company through your employer. You split the costs with your employer. Does that sound familiar? They have about 220 different insurance plans. And I would argue, would you say this is socialized medicine? No, to me, it's the opposite. It's a more private system than the US has. In America, when people turn 65, just about everybody switches to a government-run health plan. In Germany, they stay with the private insurer all the way. We have a government-run health plan for low-income people. In Germany, everybody is in private insurance, and government subsidizes the premium if you can't pay it. Are you with me on this? So this is a private model, and guess what? It works. The Germans cover 82 million Germans, about 12 million alien workers. Very, very good health outcomes, better health outcomes by far than the United States. Total choice. You pick the hospital, you pick the doctor, you pick the chiropractor, and insurance has to pay. No in-network, out-network. They don't allow that stuff. And they spend about 62% as much per capita as we do on healthcare. So this is a model that works. And a lot of capitalist countries have adopted it. The Bismarck model is used in Switzerland, in Belgium, in the Netherlands, France to a degree, Japan. Japan uses this system. In my book, I call Japan Bismarck on rice because they adopted this German model for their Asian system. in my view, not socialized medicine. Now, so I gave you one model where government provides the care and government pays for the care. In the Bismarck model, the providers are private and the payers are private. Now, the third model that we find in rich countries is a marriage of the two, and in this model, yeah, there we go. The providers, the doctors, the hospitals, the labs, the drug companies are private, but the payment scheme is public. So it's a marriage of the two, and this is often called the Douglas model, named for this great politician, Tommy Douglas. He was a socialist. He was a fire-breathing lefty socialist who happened to run for governor, they call it premier, but governor of Saskatchewan, Canadian province in 1940. Saskatchewan is a conservative, wheat-growing, farming province. It's Kansas, it's Nebraska, it's North Dakota. You guys make fun of North Dakota here in Minnesota, right? And here this fire-breathing lefty socialist runs for governor in this conservative farming state, and guess what? He won. And he won because he promised that he would provide health care for everybody in Saskatchewan. In 1940, this is a time when about 15% of the state had health insurance. And he did it. He did it by setting up this system where everybody has to pay into a government-run health insurance plan every month, comes right out of your paycheck. You go to the doctor or the hospital and the system pays. In most provinces of Canada, you don't pay. And by 1961, the system worked and it spread through all of Canada through 1961. Now, have you heard these horror stories about Canada, long waiting times, limited choice? Now, I think they're true. In my book, I'm quite critical of Canada because I think the problem is they just don't spend enough. They spend about 8% of GDP on healthcare. We're spending 17%. If they spend a little more, I think the model would work, and I know the model works because the Douglas model has been adopted in Australia, in Taiwan, in South Korea, and Australia, for example, has shorter waiting times than the United States for both elective and acute surgery. So the model can work. They haven't made it work that well in Canada. Now, I said this Tommy Douglas was a clever politician. He was good with words. And when he invented this system of public payment for private care, he came up with a name for the system. Do you know what he named it? Do you know what they call this? Medicare. In 1941, he came up with the name Medicare, and that's what it's called in Canada. And sure enough, in 1965, when President Lyndon Johnson decided that American seniors should all have a form of health insurance, he took the name Medicare and the model, public insurance for private docs, right from Canada. This is the Canadian model of healthcare. It's now used by 49 million Americans and has very high levels of satisfaction. People really like Medicare. If you suggest to seniors that they drop Medicare and go back to Aetna or WellPoint, no, they rebel. They don't like that. So here's my question for you. Is this socialized medicine? I mean, it's a public payment scheme, but the providers are private. What would you say? I know the answer to this question, by the way. Is this socialized medicine? To me, it seems very clear that the answer must be no. This cannot be socialized medicine, and it's just a matter of simple logic. It can't be socialized medicine because Americans love Medicare, and Americans hate socialized medicine. So it couldn't possibly, this couldn't be socialized medicine. But this is the Canadian model of healthcare. It's used around the world, and it works pretty well, except it works pretty well in Canada, too. If you have an acute illness, they'll take care of you. They send an ambulance for free, and they treat you for free. In Canada, the problem is, if you have something that can wait, if your knee hurts or your shoulder hurts or your back hurts and it can wait, you wait, because they've limited the number of scanners, of operating rooms to save money. But it's a model that can work. So I'm now very quickly, did I mention this? They didn't give me much time. So I've gone very quickly through the three models that we find in rich countries. But these are a minority of the world's countries. In most of the world's countries, healthcare is a luxury. I mean, countries where people make $1 or $2 a day, where per capita income is $750 a year, In most of the world's 200 countries, healthcare is a luxury. They don't have a healthcare system. Just food and clothing and shelter is tough enough. In the world's poorer countries, healthcare is something you may get. If you live in a big city, you may be able to go to a big free hospital. If you live in a village or something, you're out of luck unless you have the money to find a doctor and pay. And that's what this model is called. All economists agree on this name. In the other countries, they have what's called the, out-of-pocket model. It's exactly what it says. If your baby is sick and you have some money in your pocket to pay the doctor, she might get treated. If you don't have any money, she stays sick or she dies. That's the brutal fact of the world. It's simple, it's brutal, but that's the fact of healthcare in most of the world. If you live in a big city, you can line up at a hospital and get free care. If you don't have money, you can pay with whatever you have. I was up in northern Nepal near Mount Everest and walked up to the top of a hill, and here was this kind of plain stucco shack. It looked like a garden shed in America or an outhouse or something. And that was the local medical clinic serving about a 100-square-mile area. People walked to it. And I was inside. I said to the doctor, do your patients pay you? He said, well, yeah, some people have a little money. Some people have money, but they pay me with what they've got. And I said, well, like what? And he said, well, I eat a lot of potatoes, because that's the staple crop, and people carry a 10-pound bag of potatoes over their shoulder when they're taking their sick father to see the doctor. This is the out-of-pocket model of healthcare. It's the most common model in the world. Take an example, India, a country of 1.2 billion people, half the people in that country will never see a doctor in their life. Never see a doctor. People who live in big cities can line up at the free hospital, but most people just don't see a doctor. This is the way of the world. So I know this was too quick, but I ran through 4 models very quickly, and with variations. That covers all the countries in the world. And I did this quickly, but it took me a long time. I'm kind of a slow learner, so I spent years figuring this out at great expense. I first went around the world for my publisher, Penguin Press, and it was expensive for them. And then I made these 2 movies for PBS Frontline that John talked about, and went back around the world to see it again. And of course, PBS is funded by viewers like you, so I thank you for my travels. It was very kind of you. But here's the secret. We'll just keep this in this room. Please don't tell the accountants at PBS the secret, but are you ready? Guess what? I could have seen all 4 models and never left home. I never had to leave home, because right here in the world's richest country, we've got them all. If you think about that for a minute, you'll see I'm right. If you're a veteran like me, or in the Indian Health Service, you go to a government-owned hospital, you're treated by government employee doctors, nurses, lab technicians. You wait, I go to the VA hospital in Denver. You wait a while, you don't get to choose your doctor, the care is great, everybody treats you wonderfully, and you walk out with no bill. That's about 19 million Americans on those systems. For healthcare purposes, they live in Britain. That's the Beverage Model, the National Health Service, right here in the United States. And I think we agreed, at least I'm convinced, it's socialized medicine. But let's not tell anybody that the Veterans Administration healthcare system is socialized medicine. Americans wouldn't like that. If you're a working person sharing the cost of private insurance with your employer, well, you live in Germany for healthcare purposes. There are about 145 to 148 million Americans on the Bismarck model of healthcare. Private insurers paying private providers. If you're over 65 and on Medicare, that's 49 million Americans, you live in Canada for healthcare purposes, because we adopted the Canadian model, public payment of private providers for our seniors. And if you're one of the 48.6 million Americans without health insurance, well, for medical purposes, they live in Afghanistan. or Angola or Algeria, just another poor country. If they're sick enough, we let them go to the emergency room. If they live in a big city, they can line up at the free hospital, and if they don't have any money in their pocket, they stay sick or die. 25,000 of our fellow Americans die every year of treatable diseases because they can't afford to see a doctor. That's the out-of-pocket model right here in the world's richest country. We've got them all. And this is really a major difference between the US and all the other countries I saw, because in every other country, everybody's in the same system. You know, if there are countries that like government, that trust government, like Sweden, Norway, Britain, everybody's in a national health service and everybody's treated the same. Capitalist countries, Germany and Japan, everybody is in the same insurance system. It's different from ours. There are many payers, but they all use the same form, the same rules, and they all pay the same fee, and the premiums are the same for everybody. If you know, the companies like Canada and Australia, everybody is in the Medicare system. They don't have separate systems for people like we do. They treat everybody the same. Why would they do that? Well, there are a lot of reasons. I don't have time to go through them all, but the main reason is they think it's fairer. They think it's fairer if everybody has the same access to the same care at the same price. Fairer. Now, you remember I told you I was going to try to be an objective reporter here? But the problem is, once you get talking about whether something is fair or just or decent or humane, you're not in the realm of objective judgment anymore. That's a subjective judgment. It's fair. You know, that's a moral judgment. And this is the most important point I learned traveling the world looking at healthcare systems. The design of any country's healthcare system, at least certainly any rich country's healthcare system, reflects its basic moral values. If the country as a whole society makes the moral decision, doggone it, we're a rich country, we don't want people living in pain. We don't want people dying because they can't see a doctor. We're going to provide health care for everybody. If you make that moral commitment, then you can design a system like the ones I saw in Britain, France, Switzerland, Germany, Austria, Japan, et cetera. You can get there if you make the commitment. If you don't make the commitment, the moral commitment to universal coverage, as I argue we've never done, we've never even had the argument. If you don't make the moral commitment, then you end up with a system where some people get fabulous care in fabulous facilities with no waiting, and 48.6 million people get nothing, or just about nothing, until they're sick enough to go to the emergency room, and then we force the hospitals to treat them for free. In other words, if you don't make the moral commitment to provide health care for everybody, you end up with the American healthcare system. And my argument is that's what happened to us. That's why we're here. Now, the awareness of that shortcoming, I think, is what drove the passage of Obamacare, or the Affordable Care Act. It was designed to deal with this fundamental shortcoming in American life, that we leave so many people uninsured. And I don't have time to go into Obamacare here. It's definitely better than what we've got now, but it's not the answer. Even if you ask the White House, when their most optimistic estimate, they say when Obamacare takes full effect in 2018, we'll still have 25 to 30 million Americans without health insurance. In other words, we're still going to be way short of where all the other countries like us have gotten. And so my argument is that we should cover every American, and we could cover every American if we wanted to learn something from other countries. So here's the deal. I tell you what, because you were kind enough to listen to me, and they brought me to this town in Rochester, Minnesota that I really like, I'll do you a favor. I know you're busy. You have hospitals to run, patients to treat. You're busy people. You may not have time to read my book. You could still buy it. That doesn't take any time. We'd like that. And so I'm going to summarize my book for you in one sentence. Summarize my whole speech. You could have come in a minute ago, and I'd summarize the whole speech. Here's the deal. If we Americans could find the political will to provide health care for all our neighbors, if we could find the will to cover everybody, the other rich nations could show us the way. Thank you.
One really quick one on the Affordable Care Act, because we want to get people to dinner. It seems that the Affordable Care Act favored the Bismarck model by putting people into the exchanges and favored the out-of-pocket by basically enhancing the extremes. There are people who are going to be out of the loop, who are going to be paying out of pocket, and the extremely rich will be paying out of pocket.
Yeah, it's definitely a Bismarck solution because it relies mainly on private insurance, but there's also a big expansion of Medicaid, and that's a government-run solution. That's public payment of private payers, so that's a Canadian-style solution. As usual, we end up with the most fragmented, most complex, and most expensive system. We could have done better. We could have adopted something better, but as I say, it's better than what we've got now.
T.R. Reid, thanks so much.
Yeah. Thank you.